So they are abundant. Each female tick can potentially lay several thousands of eggs, and these eggs develop and give rise to several thousand offspring. Ticks have host preference, meaning that at a certain stage of their life could feed on the same group of hosts. For instance, deer tick or black-legged tick, both at the larval stage and at the nymphal stage, feed on small mammals, rodents, and at the adult stage, they feed on large mammals, including deer and other mammals. They have remarkable ability with regards to their feeding method. It's interesting to let you know that tick saliva has over 400 different proteins. Each one of these proteins have their own enzymatic activity. For instance, one of them is vasodilation. It refers to preventing from blood clotting. Another one is anesthetic function, meaning that you have quite often, if you have experienced tick bite, you notice that you don't feel it until ticks feed to depletion, and then serendipitously or accidentally, you see that, oh, there's a raisin on your skin. Longevity. So if you compare ticks to mosquitoes, mosquitoes live about 1 month or so, but ticks live 2 to 3 years. And this increased their ability to transmit the disease agent. So here I want to show you the tick life cycle. Let me see if I can use the pointer here. All right, so I can't step aside. So I tell you from just the external circle, as you can see, that a female tick with a bunch of, or with hundreds of egg mass over there. That is the springtime when ticks lay eggs. So if you follow the external circle and the cycle, you see that eggs develop into larvae. Larvae feed on small mammals and birds, and then continue their life cycle. And then in the larvae are active through spring and summer. Then in the spring of next year, they develop into nymph. These nymphs can feed on both large mammals and small mammals, including humans. And then nymphs are active during the spring. In the fall, they develop into adult males and females. Adult males and females spend their winter under the leaf litters or any structure that they can hide, but they are still active. Unless the weather temperature goes below sub-zero, then they pause their activity. But during those times that the temperature rises, they are active, they come up and bite. That's why in the middle of December or February, these years, you do see ticks coming and biting. So again, these adults spend their winter, and in the spring, females lay eggs again, and the cycle continues. Ticks in our region, they are involved in transmission of at least 12 important diseases. I will walk you through all these different diseases. These diseases are either caused by bacterial agent, or by viruses, or by protozoan. And the prime example of the protozoan disease is or parasitic disease is the babesiosis. Many of you are familiar, and this is similar to malaria. Majority of tick-borne diseases are unfortunately in the Northeast and a few upper Midwestern states. So over the past several years, we have witnessed the ongoing range expansion of several tick species, including Lone Star tick, Gulf Coast tick, and a longhorn or Asian longhorn tick. This is in conjunction with pervasive population of black-legged tick or deer tick that is responsible for transmitting Lyme disease and several other tick-borne diseases. And we are witnessing, unfortunately, new pathogens are popping up and emerging. And in addition to pathogen, I will talk to you about some conditions that they are not disease. Nonetheless, they are associated with tick activity, including that notorious red meat allergy. So there are at least 7 disease agents that cause tick-borne diseases, and these are associated with black-legged tick. They include those agents that cause Lyme disease. We are dealing with 2 different agents. It used to be 1 disease agent. Now we have another disease agent that causes Lyme disease. We have anaplasma that causes anaplasmosis. We have babesia that causes babesiosis. We have a type of disease agent similar to Lyme disease agent that causes relapsing fever or tick relapsing fever. And then we have, unfortunately, a very deadly virus that is called Powassan virus, and I will describe this in a few minutes. So the first disease that I will briefly mention, many of you are familiar with Lyme disease, and perhaps some of you have had experience with this disease. The disease agent or the infectious agent is an spirochete called Borrelia burgdorferi. By the way, Burgdorferi refers to William Burgdorferi or Burgdorfer, who was a Swiss scientist who came to Connecticut and worked in our institution for a number of years with Dr. John Anderson. I think that David knows Dr. Anderson. And later on, he went to work on Rocky Mountain spotted fever. This disease, Lyme disease, solely transmitted by black-legged or deer tick. It is the same, 2 different names. The incubation period varies. Incubation period refers from the time that people receive the bite and from the time they show symptoms. It takes from 3 to 30 days. And clinical presentation of many tick-borne diseases are quite similar, and Lyme disease is not the exception. It may involve fever, headache, fatigue, and a characteristic skin rash called erythema migrans or bullseye rash. I have to add, not necessarily all patients who have been infected with Lyme disease, they show bullseye rash. About 20% or so, they don't even have this bullseye rash. And diagnosis, as some of you have heard, is based on a serology testing. It's called 2-tier testing, and based on ELISA and Western blotting. Another disease that is associated with black-legged tick is anaplasmosis. I have to mention that anaplasmosis used to be called ehrlichiosis. Many of you who call my lab or call me, you refer constantly to ehrlichiosis. So we no longer call this disease ehrlichiosis. Though, as I will tell you, we have ehrlichiosis that is now transmitted by Lone Star tick. For this disease, also black-legged tick is the vector that transmits the disease. Incubation period is less than Lyme disease, 1 to 2 weeks, and clinical presentation is pretty much the same: fever, muscle pain, severe headache, discomfort, and joint pain. And diagnosis is based on cell culture and molecular procedure called PCR. We learned, unfortunately, about PCR during the COVID, and you all are expert now about PCR. So another disease that is very important, and in recent years, data shows that the prevalence of this disease or incidence of this disease is increasing rapidly in our state and throughout the northeastern United States, and particularly in our state, mostly in rural counties, is the babesiosis. This disease is caused by a parasite called Babesia microti or microti, and it is transmitted by black-legged tick. And the incubation period sometimes takes 9 weeks in order to show up. A lot of symptoms are similar to other tick-borne diseases. However, there are some differences. For instance, flu-like symptoms, fever, chill. These are some of the common symptoms. However, with this particular disease, patients quite often they experience severe headache, at least in Connecticut. Another typical symptom is that those of you who are old enough to remember or to have heard of malaria diseases, malaria has typical cycling of fever, chill, and sweating and chill, and that continues in a cycle, maybe every 24 hours, every 72 hours. Patients experience this kind of symptom, and these symptoms are the result of the parasite attacking red blood cells and taking home over there and multiplying over there. Once they multiply, they get to a point that red blood cells can no longer take them, and they burst red blood cells and release the parasite bodies into bloodstream, and then other red blood cells are infected, and as a result, you experience this kind of cyclic symptoms. And the diagnosis for this disease is quite easy if you deal with a good microscopist or a good physician. If they take a drop of your blood at the right time, and if you put it on a microscope slide and smear it, and then perhaps stain it with a staining agent, they can see the parasite body directly under microscope. If not, there are molecular tests that are common, but you need to go to specialty laboratories in order to get that blood test done. And the last disease that I will talk about, black-legged tick, is the Poisson virus. As I mentioned, this disease is becoming a common, and it is leading to mortality. It has led to mortality in some in Connecticut and throughout the region. This disease agent has two vectors. One of them is the black-legged tick. Another one is closely related to black-legged tick, that is called woodchuck tick. And the incubation period takes from 1 week to 1 month. And clinical presentations, again, fever, headache, but vomiting, weakness, confusion, loss of coordination, speech difficulty, seizure. And by the time patients get to hospital and they are hospitalized, the likelihood of succumbing to disease is very common in about 30 to 40% of cases. And another problem with this disease is that many of you have heard that, oh, this tick hasn't been on me for 24 hours, therefore I am immune. It is not the case with this virus. It takes only half an hour to 1 hour for the virus to successfully be transmitted and make people sick. But keep in mind that not all those who are infected with Powassan virus, who were bitten by Powassan virus, infected ticks, not all of those show symptoms. Some of us may just deal with it, our immune system deals with it and do not show symptoms. We are currently doing a research project on this virus, first of all, to understand what is the prevalence of infection in ticks in our state with Powassan virus. Second, to determine which area of our state we are having higher prevalence of Powassan virus. Recently, a very nice lady, has been submitting ticks to us from Wilton. Wilton is nearby, right? And this lady, twice in the past month or so, has submitted ticks to us, and both of them have turned out to be positive. And thanks goodness, the lady is a wonderful lady, and she has become a good friend of us. She says that she's not showing any symptoms. So one part of this project, go to these areas to survey the areas, find out exactly what is the prevalence of infection and why in some areas we have higher Powassan virus, in other areas we have no Powassan virus infected ticks. And diagnosis is based on clinical feature. Doctors usually ask whether you have been exposed to tick bite, where do you live, and all these things are pieces of puzzle in order to determine whether the patient is likely to be infected with Powassan virus or not. So David asked early on a question about why we are seeing this many ticks in the region, and the answer is that, first of all, we have caused a lot of changes to the environment. And then climate change is also one factor, even though it is not the only factor. We used to, those of you who are native to this part of the country, you know that several decades ago or 100 years ago, we didn't have this many white-tailed deer in the region. Now white-tailed deer has become a household member. Everybody has either a pet or a friend in their backyard, and they are everywhere. So these are some of the factors that contribute to increases in the number of black-legged tick and other tick species. Keep in mind that keep in mind that when we capture deer, we can collect thousands or hundreds of ticks on each deer. Doesn't matter what kind of ticks we are talking about. I will show you pictures. The second tick species that I would like to briefly talk about is the American dog tick. American dog tick is common mostly to the east of Rocky Mountain region, and they also have populations in the Pacific coast. However, I have to mention that in recent years, for some reason, the population of American dog tick has increased in our state. We used to have about 13% of all ticks to be American dog ticks. Now that number has become 25%. And in recent years, since 2016, we are seeing higher number of Rocky Mountain spotted fever. This tick is involved in transmission of Rocky Mountain spotted fever, another deadly disease. And I was looking at the data before I came here. So since 2016, we have had every year from 5 to 25 cases of Rocky Mountain spotted fever. But prior to 2016, we didn't have at all any disease. Last year, as a result of this increase in Rocky Mountain spotted fever, I directed my lab members to test some of the dog ticks that we have in our laboratory, in our archive. Fortunately, none of them turned out to be positive. Still, it is a puzzle for us to understand why ticks are negative, but we are seeing Rocky Mountain spotted fever. And last year we had about 9 cases. One of them was unfortunately fatal. And this year, you probably heard there was a case in Stanford, and it created some publicity. I received an email from CDC alerting me, and not realizing that that alert was based on our interviews. So my name was in that, but they didn't realize. Anyway, so my point is that we don't understand. I have communicated with neighboring states to find out exactly what their experience is. Their experience is the same. Ticks are negative, but we are seeing positive human cases. I think that it exists in tick population, but at a very perhaps low level. So another tick species that we discovered here in Connecticut, it was in 2017. We reported in 2018. That is the Lone Star tick. Lone Star tick has a wide distribution, as you can see. It used to be distributed in southeastern United States, but gradually it has moved up. In 2000, as I mentioned, in 2020, we reported established population of, so in 2017 and 18, this population was in Manresa Island. You know Manresa Island. But in 2020, we found it in Stratford, Bridgeport, and later on in New Haven County. In addition to those populations that I mentioned, we have populations in New York area and Suffolk County. We have in one population that has been there in Rhode Island, in Newport area. Then we have populations in New Jersey. And as I mentioned, in Connecticut, we discovered these populations in 2020 and after that. And there are also populations in Cape Cod region as well in Massachusetts. So this tick is an aggressive biter. And as you can see, this is a tick that succumbed to the heavy infestation in Manresa Island. You can see hundreds of ticks on this deer. And this, in addition for Lone Star tick to be involved in several disease transmission, mere bites from this tick could cause severe irritation and rash. This is a lady from, it was from Fairfield County, I forgot the name of the town. She walked into our laboratory in 2021, and she had a bag with a few ticks, and we examined that those ticks, they were larvae. And all these rashes throughout the lady's body was the result of bites from a few tick specimen at larval stage. And this lady, it took several months for her. She went through antibiotic treatment until she recovered from this severe rash. So Lone Star ticks is involved in transmission of a number of disease agents. Two of them cause ehrlichiosis. Then it is involved in transmission of two viruses. Those viruses are Heartland virus and Bourbon virus. I have to add that right now our major concern with this tick is that, particularly in Fairfield and New Haven counties, is that because this tick is becoming very common and it is very competitive tick, our concern is that this tick eventually will conquer the area as it has been so far. Right now, it is very common in coastal areas, but it is moving gradually to inlands. About 10% of ticks we receive from Fairfield County right now, they are Lone Star tick, and that's a lot of ticks. This tick is also associated with alpha-gal syndrome or red meat allergy. Alpha-gal syndrome was first identified in 2004, and since then studies show that we have had about 110,000 during the past decade or so alpha-gal syndrome. I want to add that unfortunately, this condition is becoming very common throughout the region. In New Jersey last year, they showed that the number of alpha-gal syndrome or red meat allergy is the third after Lyme disease and babesiosis. And as you know, there is no cure. If someone develops alpha-gal or red meat allergy, it will unfortunately be with those people for the rest of their lives. And it is not that easy. It could lead to complications. Therefore, those who have been diagnosed with alpha-gal syndrome, they have to see allergists and be under watch to make sure it doesn't lead to complication. We just recently started a research project on alpha-gal syndrome with Yale University and CDC to understand what is the prevalence of exposure to alpha-gal syndrome in our state, to see what percentage of population have it or potentially will soon have it. Another tick is the Gulf Coast tick. We discovered this tick population in 2020 again in Fairfield County. I think that we have to change the name of the county, perhaps. So this tick, as the name implies, it is common to the Gulf region, to the southern Atlantic area. Established population of this tick has been reported in several states, as you can see: Arkansas, Illinois, Kentucky, North Carolina, several mid-Atlantic states, including Maryland, Virginia. The northernmost edge of distribution of this tick species was Delaware. But in 2020, it showed up in Connecticut for the first time. No other state had this tick in the region, had this tick species. And later on, in 2022, they reported from New York. And it does appear that the populations that we are seeing in the region, population of Gulf Coast tick, is rather recent population based on the genetic analysis that we have been doing. So juvenile stage or immature stages of Gulf Coast tick, they are associated with birds, and adults are associated with white-tailed deer. This substantially facilitates the movement or migration of this tick species. This tick species, when we discovered this tick, we collected specimens from that Long Island in Stratford. Is that called Long Island or Pleasure Beach? In that area, not Long Island, sorry, Long Beach. So when we discovered this population, we collected, first of all, we discovered this population in October. And I was hoping that winter month, this tick, because it's a southern tick, will not survive and we will be okay. Much to my disappointment, next year I went there, it was there. And when we collected specimens of this tick and tested, it tested positive for a rickettsia called Rickettsia parkeri. This is a disease agent similar to the disease agent that causes Rocky Mountain spotted fever. And 30% of ticks were infected with Rickettsia parkeri. And later on, when we discussed with CDC didn't buy the argument that this is a risk. Until last year, we received a tick from a lady who lived in New Fairfield. And we identified the tick was Gulf Coast tick. For curiosity, I advised the staff to test this tick. And we tested, and the tick tested positive for Rickettsia parkeri, the agent that causes Rocky Mountain spotted fever. We immediately contacted the person who submitted the tick. It was a young lady in her 29. And she said she was sick. I drove with my technician to New Fairfield. I met with this lady, and we took the lady to doctors, and testing was done. We sent some of the serum sample to CDC. We found out that the lady was sick with this disease. Now, this is example of what we are facing and what the challenges are ahead of us with regards to new tick-borne diseases. This is just an example of these newly emerging tick-borne diseases. The last tick species that I would like to mention is the longhorn tick, or when this tick was introduced to the United States, it was called Asian longhorn tick. We decided just to call it longhorn tick. So it was in 2017, this tick was discovered in a sheep farm in New Jersey, and within a few years, this tick spread to several states. Now it is in 19 states, as well as the District of Columbia, and of course in Connecticut. This tick has a remarkable ability to survive different environmental conditions, and we predict that this tick will occupy much of the United States. We were the first group to report that this tick bites human. However, other states, the rate of human biting by this tick is not that great, and that is a good news. But we will have to remain cautious to see whether this tick would evolve further to bite humans readily. This tick species in its invasive range in Australia, New Zealand, and several Pacific islands, and in its native range in South Asia, China, Japan, South Korea, and other areas, is capable of transmitting at least 30 disease agents. In the United States, so far, this tick is capable of transmitting a disease agent called Tayleria orientalis, or the disease is called Theileriosis. And it is now becoming a major problem in those areas that they are having cattle industry. We and others have isolated disease agent responsible for Lyme disease, babesiosis, and anaplasmosis from this tick species. However, it is not clear whether this tick is capable of transmitting these diseases. There is a term called vector competency that refers to whether, not necessarily if a tick turns out to be positive, that tick is capable of transmitting the disease agent. It could just have acquired accidentally. In order to successfully transmit the disease agent, that tick should have the competency that is evaluated in laboratory setting. And so far, our analysis suggests that this tick might not be competent for transmitting Lyme disease, babesiosis, and others. However, this tick is capable of transmitting heartland virus. Remember, I mentioned heartland virus is transmitted by Lone Star tick, but this tick is capable of transmitting heartland virus. And also last year we did an experiment, and first of all we collected ticks from throughout the region, even from Pennsylvania. We found out that those specimens of this tick, unlike other tick species that once they are attached, they feed until they are fully engorged and they drop off. This tick has the habit of taking partial blood meal. Similar to mosquitoes, when you chase mosquitoes, they go and bite someone else. This tick has this ability to take partial blood meals. In other words, because the tick has this ability, therefore it doesn't matter for the tick if it is capable or not capable, because it can take disease agent during the partial blood meal and transmit to another host, another human, during the second partial blood meal. Then it doesn't matter whether it's competent or not. It will automatically transmit the disease agent. So I want to give you some example for the remainder of time here. So our several decades of data in our tick testing laboratories suggest that nearly 85% of all ticks that are submitted to our laboratory are black-legged or deer tick. This is somewhat correspond to what is happening in the nature. Our nature or field surveillance also suggests that we are having the same prevalence of or abundance of ticks, followed by black-legged tick. That's 13%. I mentioned to you that that number in recent year has increased to nearly 25%. The Lone Star tick has been around 3% for the past several years, but in recent years that number has increased to 4 to 5%. In counties like Fairfield and New Haven County, that percentage rises to 10%. Over the past decade or so, as you can see, population of all three tick species, black-legged tick, American dog tick, Lone Star tick, has increased substantially. Some of them, like black-legged tick, American dog tick, you see some fluctuation in the population of these two tick species. However, Lone Star tick population has increased rather substantially and without any fluctuation. So, black-legged tick is the most important tick in our region, and it has 3 peak activity. The first peak activity occurs, let's start with the middle peak because it appeared on the screen. So we have nymphal activity, nymphal tick activity. Nymphs are juvenile ticks or teenager ticks. Nymphal tick activity reaches a peak during the month of June. And when you look at Lyme disease data, you see that a lot of Lyme disease cases also occur during the month of June and early July. And the reason is that because nymphs are small, quite often they are overlooked and they get a chance to feed, to become fully engorged, and therefore successfully transmit Lyme disease, babesiosis and other tick-borne diseases. So this is the first peak. Adult ticks have two peak activity. One of those peak activity, as you can see, occur in the month of April, May. Right now we are in the midst of peak activity. And then during the month of August and September, we hardly ever see questing ticks or ticks that are actively looking for hosts to bite. And then they start in October or end of September. They reach a peak in November again, and they fall off. But that population, the peak slows down, but as I mentioned early on, black-legged tick continues its activity during the winter month as long as temperature is above freezing. So if you want to know who are at greater risk, children less than 10 years old are at greater risk, not because they have a factor or any kind of sensitivity to tick bite. It's just because they are active outdoors, particularly in those wooded areas. Then the next group are those at retirement age, David. Stay away from wooded areas. And then we have those youngsters or younger generation, age 20 or 18 to 25 or so. As you can see, they are at lower risk because they don't go out. They watch TVs and play games. All right. Now, the prevalence of infection with Lyme disease, with Borrelia, Anaplasma, and Babesia, as you can see, have increased substantially. There has been some fluctuations, but in recent years we are seeing even up to 50% of ticks to be infected with Lyme disease, sometimes higher than that. And the same, the prevalence of infection in ticks with Anaplasma and Babesia has increased also. We are right now standing at around 7 to 8% of Anaplasma and Babesia to be 12% and more. I have to let you know that the prevalence of infection with Babesia during the past year has increased substantially. Sometimes we are seeing, the other day we had 24% of ticks to be infected with babesiosis. So in other words, 1 out of 2 ticks is infected. So you can't take chance. Then in addition to ticks to be infected with single disease agent, we are seeing ticks to be up to 6% of ticks are infected with 2 or 3 disease agents simultaneously. And you can imagine the complication that this brings to diagnosis and treatment of tick-borne diseases, because not all tick-borne diseases or tick-related diseases can be effectively treated with antibiotics. So I mentioned about factors that driving tick-borne disease increase and expansion. One of them is land use and land cover. As you know, particularly in this part of the country, in this part of the state, you know that a lot of these lands that we have home in there, they used to belong wildlife. And I was just driving along the Merritt Parkway, and I was thinking, oh Jesus, these lands used to be a kind of connected land. Now we have caused this kind of separation, and wildlife cannot cross, cannot move over. I saw a chipmunk was wondering where to go, because these are some of the reasons that we are seeing this many ticks, because we have caused potential disruption to the environment that we live in. Habitat fragmentation, I already mentioned. Climate is not only causing changes into population of wildlife, it's also changing the vegetation structure throughout the area, throughout the region. We are seeing changes in the host community. I already referred to the population of white-tailed deer, population of other large mammals have also increased without having a cap, particularly in urban areas, without having a real natural enemies to control their population. One reason for seeing higher number of tick-borne diseases is perhaps the result of awareness and increased diagnosis and reporting. And of course, climate change is impacting all these factors that I mentioned. In the northeastern United States, to wrap it up, we are experiencing increasingly warmer temperature. During the past several years, we hardly ever had any winter time. We couldn't even call it winter. 20 years ago, when I came to Connecticut, our station that is in New Haven, it was so much cold, and for us, the area, that it took several weeks until we could walk in our campus. And now you can see that we don't have that one. Just during the past winter, we only had 1 week of cold temperature. That was it. And that this is the warmer temperature allowing ticks to survive better. There is no freezing temperature to put a dent into their population. As a result, winter months are becoming short, springs are longer, summer are longer, and then we used to call it tick activity season. We no longer call it tick activity season because ticks are active year-round. Another thing is as I mentioned during my talk, repeatedly I refer to white-tailed deer. White-tailed deer is hosting several tick species in our region, and it is providing them with ample blood so that they can feed and they can lay eggs and thrive. So what to do with tick populations and with ticks? So the first thing or the most important approach that we can take better than any other approach is to be aware of our surrounding. Walk in the center of trails if we go out for outdoor activity, and avoid going to those wooded areas, brushy area, tall grasses area. Wear light-colored clothing all the time when you are active outdoor, and I have probably mentioned during my talks everywhere, quite often I do go to do surveillance, and so far, thanks goodness, I haven't had even a single bite. And it is, there were times that I have collected several hundred ticks on myself, but not on my body, on the coverall that I put on, or white-colored clothing, and tuck your pants into socks. Use repellents, particularly DEET. If you have exposed skin, apply DEET directly onto your skin. It provides good level of protection. And also consider using pesticides. So you can put a pair of pants or shirts aside and use for outdoor activity. Before you go for outdoor activity, spray those with pesticide that you can get from Home Depot and other hardware store. Spray clothing and let it dry for about 10-15 minutes or half an hour maximum. Then put it on. Make sure you don't put those clothes on your direct skin. Have a underlay, and so that in case of perspiration, that pesticide would not get into your skin. It's important to perform tick check every 2 to 3 hours after outdoor activity, provided that you are only concerned about Lyme disease. But for a disease like Powassan virus, as I mentioned, it takes half an hour to 1 hour. Therefore, even that is not going to take care of these tick activity. But perform tick checks under those areas that are moist and warm, like underarms, around ears, around belly button, around the head and body hair, between the legs and around the waist, and keep pets free of ticks. I think that David asked me to give you a brief explanation of what we do at the experiment station, and I would like to take a few minutes. At the experiment station, we have 4 campuses. The main campus is in New Haven, in the city of New Haven. We have another farm or another campus in Hamden. It's called Lockwood Farm. Then we have a campus in Griswold. We have a campus in Griswold that was dedicated, still it is dedicated to investigate mosquito-borne viruses, especially Eastern equine encephalitis virus. Then we have another campus in Windsor that's called Valley Labs, and it used to they used to work over there historically when tobacco industry was thriving in this part of the country. So in our institution, we focus our work on 4 major areas, or 3 important areas and 4 major disciplines. These areas include public health, environmental health, and plant health. So in public health, we have a group called vector-borne zoonotic. So we have a center at the experiment station called Center for Vector-Borne Vector Biology and Zoonotic Diseases. We have a group of 8 scientists and up to 20 technical staff who work on tick and mosquito-borne diseases. We have a group that work on environmental health, anything that relates to soil and water. Then we also have a group that work on plant health, plant diseases, and insects. In addition to these activities, we also have 2 important information offices. Some of you have walked into these offices. One of them is called Insect Information Office, that people bring their insects, whatever insect it is, and whatever even non-insect they have, for diagnosis and getting advice what to do with that, whether it could be on your backyard, it could be in your house, it could be in the environment. Right now, we are dealing with infestation with a fly in Mystic area. There's a dispute between neighbors because one of the neighbors is having a few cattle in his yard. So anyway, so whatever that problem that has to do with the insect, we also have plant disease information office. People bring their diseased plants and they are examined and advised are offered. Then we also have tick testing laboratory, soil testing laboratory. So people bring their ticks, as you know, or they bring their soil sample for testing. And so I have to mention that the experiment station is unique in a sense that it is the first agricultural experiment station in nation. It was established in 1875, and it's the first agricultural experiment station that is not affiliated with a land-grant university. This is a standalone institution. We are getting, right now we have nearly $20 million coming annually in grant funding, competitive grant from NIH, CDC, NSF, USDA, and so very pleased to report to you that we have been fortunate that both Senator Blumenthal and Senator Murphy have been very nice to us, and in the past 2 years they have supported our tick testing laboratory by a generous grant, and as a result of their kind support, we are able to do this much work. Thank you very much. I stop at this point, and I would take your questions.